So today we are talking about the endocrine system. This is going to be a brief review of the major components, anatomy, and physiology of the endocrine system. So the endocrine system produces chemicals called hormones that help regulate many body activities and functions. Our endocrine system is a complex message and control system. It's going to integrate many of the body's functions together. So hormones, again, are produced by this endocrine system and they are released directly into the bloodstream. So because they're released directly into the bloodstream, the hormones are delivered to all the tissues all over the body. So nervous signals, remember, are very directed at a specific area of the body, but the hormone signals are mass messages that go out through the whole body. So the body usually engages in endocrine response when it needs some kind of sustained or prolonged response, whereas a nervous signal is a very quick thing, quick reaction. The hormone response, the endocrine response, is going to be more of a sustained long-term thing. So for example, a sympathetic nervous system response will trigger the release of epinephrine and norepinephrine. So our brain controls the release of the various hormones from the endocrine glands of the body. So the endocrine system is still under control of that central nervous system. So the central nervous system essentially stimulates the endocrine system to trigger the release of the various hormones. Excess hormones or deficiencies in hormones can cause various diseases for our patients. So again, any kind of imbalance, anything away that moves us away from homeostasis could create a problem for our patients. The endocrine system is made up of several different glands. The secretions of these glands are hormones. So we're going to take a look at a few of these glands and their associated hormones. The pancreas is a key organ of the endocrine system. Among other functions, it secretes the hormone insulin. And insulin, as we have briefly discussed, is critical to the body's use of glucose. Remember that insulin is going to help those cells take the glucose up out of the patient's bloodstream. The pineal gland is a deep structure located in the brain. It is responsible for producing melatonin. This hormone, melatonin, inhibits the functions of the reproductive system and also gives you the feeling of being tired. So melatonin in this way helps prepare the body for sleep. That pineal gland also does a lot of regulation of the other kind of cyclical behaviors of the body. So your sleep-wake cycle are really regulated by that pineal gland. Your thyroid is a gland that produces a hormone necessary for the metabolism of calcium and phosphorus in the bones. And then our adrenal glands are located on top of our kidneys. So renal is a root that generally refers to the kidney. So adrenal meaning above the kidney. So these sit just on top of the kidneys and they secrete epinephrine and norepinephrine. So this is also where the name adrenaline comes from, because it's secreted by these adrenal glands. So adrenaline being the same thing as epinephrine. So these hormones serve as chemical messengers to further engage or disengage the fight or flight or rest and digest responses. Sympathetic stimulation of those adrenal glands will stimulate the release of epinephrine and norepinephrine. So these hormones prepare the body for some kind of sustained response. They postpone muscle fatigue, they increase the storage of sugar, they control kidney function, and they're going to regulate the metabolism of salt and water. So really prolonging our body system for some kind of prolonged, sustained response. So two hormones that work in concert to help regulate our blood sugar levels are insulin and glucagon. So these are both secreted by our pancreas. Insulin helps move the glucose into cells to be used for energy. And it also stimulates the liver to store glucose as glycogen. So this insulin signal, as we said, these hormone signals are going to go into the bloodstream, which means they're going to travel everywhere, all over the body. And they're going to be picked up by a variety of different cells, tissues that are going to have different responses depending on which cells, which tissues pick these up. So within the cells of the body, or let's say the muscles, it's going to help the glucose move into those muscles to be used up as energy. Whereas insulin will stimulate the liver cells to remove sugar from the bloodstream and store it away as glycogen. So then glucagon really does the opposite of insulin. It initiates the breakdown of glycogen into glucose. So when the patient's blood sugar levels are low, or your body will stimulate this breakdown of glycogen into glucose by releasing glucagon via the pancreas, via the endocrine system. So when our blood sugar increases, the pancreas secretes insulin. This increases glucose uptake into cells and the liver, and this will in turn decrease the patient's blood glucose, right? So they start at a baseline, they eat something and it spikes, and then they secrete the insulin and the blood sugar level comes back down. When blood sugar decreases, the pancreas will secrete that glucagon, which is going to increase the conversion of glycogen back into glucose, release that glucose into the blood, which will in turn increase the patient's blood glucose. So you'll revisit this idea when you get to endocrine emergencies. Just be aware that these two hormones work together to accomplish normal body function. Glucagon, as we see up here on the slide, can also be one of those medications that we give as EMTs to a patient with hypoglycemia or low blood sugar. So now we're going to look at a few other glands of our endocrine system. The gonads, also known as the ovaries and the testes, produce the hormones that govern reproduction and sex characteristics. Our pituitary gland is one of the deepest structures at the base of the brain, and it's referred to as the master gland. We call it that because it regulates growth. It regulates the other endocrine glands. It controls the metabolism of fat, as well as blood sugar reactions and urinary excretion. So that pituitary gland really directs a lot of what's going on with the other endocrine glands. Then there's one other gland called the thymus. This gland is found in the center of your chest, kind of right over top of the heart. And it secretes a hormone called thymosin, which influences the development and maturation of the immune system. So in pediatric infant patients, the thymus tends to be pretty large. And as your immune system develops, the thymus will kind of get smaller into adulthood. It's not usually as large, prominent, pronounced in adults as it would be in children. So as we just noted, epinephrine, also known as adrenaline, and norepinephrine are two hormones secreted by our adrenal glands. These hormones produce many of the signs and symptoms that we're going to see in a patient when the sympathetic nervous system is stimulated. So remember that when we have that sympathetic nervous system stimulation, it's going to stimulate the adrenal glands to release these hormones. So to understand the signs and symptoms that are produced in this sympathetic response, we have to understand the basic effects that these hormones have on the body. Okay, so we call them alpha and beta effects respectively. So alpha 1 effects primarily act on the blood vessels. Okay, so alpha 1 effect is going to cause vasoconstriction. So what we see here is the vessels in the skin are going to be significantly affected by alpha 1. So when those blood vessels in the skin constrict, the blood is going to shunt back to the core of the body. Right? If we're shunting the blood back to the core of the body, the warm blood is no longer going to be in a large amount in great quantities up at the skin. So if we were to touch the skin is going to become cool, pale looking. Alpha 1 stimulation is also going to cause the sweat glands to release sweat, which will cause the skin to become not just cool, but also moist and clammy. So the next set of effects are called beta effects, and we have beta 1 and beta 2 effects. So beta 1 affects the heart. Beta 2 affects the lungs, right? You can remember that because we have one heart, right? So beta 1 affects the heart, and we have two lungs. So beta 2 affects the lungs. So what is the difference between these two effects? So beta 1, again, relates to the heart rate. So they're going to increase the heart rate. It's going to increase the force of cardiac contraction, and it's going to speed up the electrical impulses that travel through the heart's conduction system. Beta 2 effects, again, these are going to be on the lungs, so they're going to cause smooth muscle to dilate, especially in the bronchioles, and then also in some other blood vessels on the body, but primarily in the lungs. Epinephrine and norepinephrine, again, are those two primary hormones secreted during sympathetic activation, so of the nervous system. The hormone epinephrine stimulates all receptor types. So when it is secreted by the adrenal glands, or if it's administered to a patient, remember that epinephrine is an emergency medication we could give. We would expect the actions we just listed on the last slide to occur and see the signs related to these reactions. Epinephrine is used to treat patients with severe allergic reactions or to combat problems found in the condition, primarily vasodilation and bronchoconstriction. So remember that we said, right, alpha-1 effects are going to be vasoconstriction, so that solves the problem of vasodilation. And then a beta-2 effect is bronchodilation, so it's going to solve the problem of bronchoconstriction. All right, so that's why we give this medication during anaphylaxis or other allergic reactions. So norepinephrine causes primarily alpha effects with very little trace amounts of beta-1 and beta-2 activity. Thus, most of the effects of norepinephrine are seen in the blood vessels and skin, so pale, cool, clammy skin. Recognizing these signs and understanding how they are produced may lead you to suspect the presence of some conditions much earlier, which is going to afford us more time to provide better care for our patients. For example, in a patient who's losing blood, the body will try to compensate by releasing epinephrine and norepinephrine, but being able to recognize the signs and understand why they're occurring is going to help us to suspect the blood loss much earlier and treat the patient more aggressively. Also, we're going to be administering or assisting with the administration of drugs containing these properties. So the alpha receptors are located on the arteries. When that alpha receptor is stimulated by epinephrine or norepinephrine, it's going to cause the arteries to constrict. So if the arteries are constricting, this is going to cause the blood pressure to increase and will also increase the blood flow that's returning to the heart. The blood vessels in skeletal muscle lack alpha receptors because they need to stay open to utilize the increased blood pumped by the heart. So that's just some interesting physiology there for you. Again, the blood vessels within your skeletal muscles don't actually have alpha receptors. Beta-1 receptors are located in the heart. So when beta-1 receptors are stimulated, they increase heart rate, they increase the heart rate strength of contraction called contractility. Beta-2 receptors, again, are located in the bronchioles of the lungs and the arteries of our skeletal muscles. So when these receptors are stimulated, they increase the diameter of the bronchioles to let more air in and out during breathing. They also dilate the vessels of the skeletal muscles so they can receive the increased blood produced by stimulating the alpha and beta-1 receptors. Okay, so we're going to see these affect alpha, beta-1, and beta-2 all with epi. And then norepi is only going to have the alpha effects. So why are we talking about alpha beta effects? As I said, epinephrine is one of those medications that we give to patients experiencing anaphylaxis or an allergic reaction. So when we administer epinephrine to a patient, we expect that their blood pressure is going to increase, that their heart rate's going to increase, the cardiac contractility, the force of those contractions is going to increase. They're also going to have dilation of their bronchioles and dilation of vessels within their skeletal muscle. So these would all be effects of giving this medication to a patient. So even though we're giving it to the patient to increase, let's say, dilation of their bronchioles, as a side effect, it's going to cause an increase in the patient's heart rate, right? They might become tachycardic as a result or a side effect of us giving them this medication. Albuterol is another medication that has an effect on these alpha beta receptors. Albuterol specifically only stimulates beta 2 receptors. Okay, so it doesn't have anything to do with beta 1 or alpha receptors. So remember that those beta 2, again, are focused on our lungs. So they cause dilation of the bronchioles if we give albuterol. So this is why this medication is often given in asthma rather than epinephrine, right? So even though epinephrine could cause dilation of the bronchioles, we know that epinephrine is also going to cause that cardiac stimulation as a side effect. So if we give albuterol instead, they don't have that alpha stimulation, so there's no excessive cardiac effects with the use of albuterol. So that concludes our review of the endocrine system. If you have any questions, feel free to comment on the video, or you can email me at emtinstructorjeremy@gmail.com. Thanks for watching.